This is Dr. Philipose over at Venturis Clinic, and I've got Alicia over here to help me demonstrate a couple of things that we do for vertigo. So vertigo, as you've seen in some of the other videos I talk about, is something that really affects thousands of people every year. The progression can actually get worse, and you can get dizziness, you can get a loss of balance, you can get nausea, and sometimes vomiting. And a lot of our patients have tried different physical therapy, they've tried medications to no relief. And so one of the treatments that I do is to check for some of the rotational events of the first vertebra. So the very first vertebra is important because it houses right below the brain stem itself, and it can shift and move. And if you have vertigo, what you can do is actually kind of palpate right below the skull off to the side, and if it's tender, you can kind of feel a bony prominence on one side versus the other. And what I'll usually do is kind of palpate. I don't do any type of aggressive type of manipulation because you can actually make the vertigo a lot worse. And so I'll use a tool like this where you can actually palpate, and it'll make a couple of noises, but it's very gentle. So some patients have severe osteoporosis, they may be at a high risk for strokes and things like that. So I'll kind of just go in there, you'll hear a couple of clicks, and then we'll repalpate, and it's that simple. And usually the relief can be seen in as little as 1 week. If you know somebody that has vertigo, or you yourself has been suffering from vertigo, please visit us on the web at venturisclinic.com, or you can go on YouTube to see a lot of our videos and explanations. You can also call me at 405-848-7246, and you can kind of see some of the other treatments we do, such as dry needling or prolotherapy or even ozone, to kind of help with conditions like vertigo and dizziness.